A very good morning and welcome to Panacea. Many goals, and we are doing a lot of initiatives about yoga, nutrition, and psychiatry. We have also included with us tuberculosis segments right now. And for the time being today, we have with us Shohini Roy Chaudhary again doing us a yoga session with us today, and it will be about yoga for immunity. I welcome you to the show, ma'am.
Namaskar and thank you, Pooja. Good morning to all of you. I would like to thank Beatrice, Mylan Health, Elets, Narayana Health, all of you for creating this project towards a healthier India, towards a better 2021. As you all know, that the COVID-19 is resurging again in Maharashtra and other states, and we still need to build our resistance to keep in good health. And a lot of people who are COVID survivors need to keep on building up their resistance to restore their health so the lungs are not compromised. As you all probably know, that India suffers from 37% of the total tuberculosis diseases in the whole world, according to the WHO, which is the highest percentile that a country can suffer from. And in the last 4 years, there has been more than 4.4 million affected patients, affected victims of tuberculosis, and there are almost 20,000 deaths of this disease, from this disease, every quarter. So COVID-19, as you know, affects the lungs, and with weaker lungs, one needs to keep TB at bay. So today, my yoga session would be focused on how to keep tuberculosis at bay, and if one has suffered already, how to fortify your lungs further. Of course, as we all know, if someone is suffering from tuberculosis, a full-fledged medical regimen is necessary, medical treatment, antibiotics is necessary, and yoga can just complement your resistance towards tuberculosis, your recovery, and to keep TB at bay. So, as you know, the tuberculosis virus attacks the lungs. So, to fortify your lungs, the respiratory yoga exercises, the pranayamas, are very important, because that opens up your chakras, your chest chakras, the Anahata chakra, and helps to take in more and more oxygen and detoxify your body. So I would focus today on the asanas, on the breathing exercises that are towards building a healthier respiratory system, towards fortifying the lungs. The first pranayam that I show you would be the Viparit, which is the alternate breathing. You could sit in your Padmasana or your Sukhasana, which is just crossing your legs comfortably. The left hand over the left knee, the right hand, the ring finger out, pressing over your left nostril. Breathe in deeply through your right nostril. Breathe in. Press your right nostril with your thumb and release the left nostril. Breathe out. Breathe in through your left nostril. Breathe out through your right. Breathe in through your right nostril. Breathe out through your left. Breathe in. Breathe out. Breathe in deeply. Feel the oxygen, feel the energy into your body, and breathe out. Continue 30 times. Breathe in, breathe out. 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 Breathe in, deep, deep breathe. Breathe in, breathe out. Breathe in deep, breathe out. Breathe in, breathe out. Continue. Breathe in through your right nostril, breathe out through your left. Breathe in through your left, breathe out through your right. Breathe in and breathe out. Breathe in, breathe out. Breathe in, fill in your lungs completely till you can breathe in no more, and exhale. Breathe in through your left nostril, breathe out. Breathe in through your right, breathe out. You could do this for 5 to 10 minutes every day. This really helps fortify your lungs. Also, it's good for your spine and your nervous system. It combats depression, anxiety, and builds up good resistance. The next respiratory or breathing yoga that we do is going to be the Kapalbhati. Kapalbhati is the restricted breathing, which means you breathe in fully at one go and breathe out in shorter, intense parts. When you breathe out, pull in your stomach, totally pull in your stomach, feel it in your thorax. And when you breathe out, let your stomach muscles go. This is how we do it. Breathe in. You could sit in Sukhasana or Padmasana if you're up to it. Here, your hands loosely over your knees. Breathe in. Pull in your stomach. See, the stomach is pulled in. As you breathe out, for 10 breaths. Breathe in and breathe out. Breathe in long till you can breathe in no more. Breathe in long and breathe out intense, short, and hold back for 10 times. Ideally 30 times. Today we do it 10 to 15. Breathe in and breathe out. Breathe in. Feel your stomach muscles going. Feel your thorax going. Try and put your navel towards your spine. Pull in your stomach. Breathe in. Fill your lungs with oxygen and breathe out. Till you have no breath left. Breathe in and breathe out. Breathe in and breathe out. Breathe in, breathe out. Breathe in, breathe in, breathe out. 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 Breathe out. Breathe in and breathe out. I think all of you should feel very energized because this really helps your blood circulation. This puts oxygen into every cell of your body to wake you up, to energize you, to feel very energetic, to do away with lethargy, with depression, anxiety, hypertension. The third pranayam that I'm going to do is the Benoprani, where you breathe deeply and breathe out with equal intensity. You can sit at Sukhasana, just crossing your legs, Sukhasana, the comfort posture. Or if you're a little more flexible, you could sit at Padmasana. And for all those who can't sit on the floor or you can't sit on the mat, you could sit on a sofa or a chair rather, with a hard, firm surface, and you can be doing it from there. You know, if you have issues with your issues with sitting on the floor, you can sit on a high surface, on a hard surface, and you could do your breathing exercises and give your lungs the exercise and your fortification that it needs. Now we are going to do the Belo Pranayam. Again, your hands can be over your knees like this or like this, and you just breathe in and breathe out with equal intensity. It's called the Belo breath. Breathe in, breathe out all through your nostrils, not with your mouth. And you'll hear the gushing out sound, the gushing in and the breathing out sound. You will hear it like the waves of an ocean, like the wind bellowing. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe out. Breathe in, breathe out. You can do it 30 to 50 times or even 100 times is good. Six, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. You could do it for 50 to 100 times each of the pranayam. Now I would say that for 10 seconds, if possible for you, let's sit in the Padmasana, because that really fortifies your lungs and helps your lower body, your spine health, and your nervous system and your entire equilibrium of the body, which is necessary for the absorption of oxygen within. So we will cross over the lotus posture, the right leg over the left leg and the left over right, and arms outstretched in the Dhyana Mudra, the index finger pressing over the thumb straight. Feel your body, lengthen your spine, completely lengthen your spine, lengthen your spine. Pull in your stomach, lengthen your spine, and breathe normally for 10 counts and sit in your Padmasana. 1, breathe in, 2, 3, 4, 5, 6, 7, 8. Lengthen your spine completely. Press your body, the lower back to the floor. 7, 8, 9, and 10. Now we change legs. So now it is the right leg over the left leg first, and then the left over right. Again, your Jnana Mudra over your knees. Breathe 10 times. Hold your posture. This is very good for your lower back, for your equilibrium, for your spine. Lengthen your spine. Your spine health is very important. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Stretch out your legs in front of you. I hope you can see me. Stretch it out nicely in front of you. You should really feel energized now. Body feels lighter with all that oxygen going in. Your breathing would be more robust. You would feel energy and ready to take on the day. We are going to do Padhana now, touching your toes. And while you do that, your face or your forehead should be on your knees. Do as much as you can. If you can just come up to here, maybe that's all right. Maybe you can touch your knees. You can barely touch your toes, or you can hold your feet with your hands. Ready? And lengthen your spine, go down. Rest your forehead on your knees and count 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And come up. This is very good for all your legs and your spinal health and your nervous system. Lift up your hands again and stretch as much as you can. Stretch as much as you can. And lower your forehead on your knees. Count 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. This is the Padottanasana. Now we are going to do our Bhujangasana, which is the cobra, which is also known to be very beneficial for lung health, for your respiratory system, and it is prescribed as one of the 5 primary asanas that really helps keep tuberculosis at bay and strengthens, fortifies your lungs. Lie down on your stomach so that your forehead is on the floor. Your hands are by your side. Slowly bring your palm. Rest your fingers on the floor, your palm on the floor. And it is at the level of keep your hands at the level of your shoulder. Then on the weight of your palm, lift up your body, your face, your chest, and your abdomen. And here you are. Stare at a point wherever straight onwards. Count 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. This you can do maximum for a minute each time if you want, and for about 5 times for each session. Take 5 seconds off to recover from each yoga asana. 1, 2, 3, 4, 5. Now bring your palm to firmly rest on the mat at the level of your shoulder and lift up to your abdomen in the cobra posture and look straight ahead of you. Don't back bend too much. 1, 2, 3, 4, 5, 6, 7, 8, 9, and slowly lower yourself. Rest for 5 seconds with your arms by the side. 1, 2, 3, 4, and 5. Bring your palm to rest at the level of your shoulders and lift your body up for Bhujangasana. Hold your body up. This is very good for your spinal health and your lower back. If someone suffers from lower back pain, this is very good. This actually works instantly. 1, 2, 3, 4, 5, 6, 7, 8, 9, and lower your body. Lower your body on the floor. Count 5. 1, 2, 3, 4, and 5. This is Bhujangasana, which is also prescribed as building resistance for the lung. Next, we are going to do the Tadasana or the mountain climbing posture, which is also good, very good for your balance, for equilibrium, for toning the thighs and the stomach and the ankles, taking away leg pain, and it is very good for fortifying the lungs and the respiratory organs. We are going to go into Tadasana now. I hope you can all see me. We stand first with our hands by the side. Then as we breathe in, we raise ourselves on our toes, taking the lifts, the heels off the floor, and stretch up. 1, 2, 3, and the arms are above the head, fingers interlocking. 1, 2, 3, 4, 5, 6, 7, 8, 9, and lower your body. Once again, up on your toes, heels away from the floor. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Down you go. You raise your body. Your ankles are raised, entire body is raised, heels are away from the floor, and you're standing on your toes. Your hands are lifted above the head as much as you can, stretching it out as you breathe in and out, and the fingers interlock. Ready? Go up. 1, and stretch your hands, interlock your fingers, stretch your body as if you're climbing a mountain, reaching out, reaching out, reaching out. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. You can do 10 cycles of this. It's supposed to be very good. One of the best asanas that fortifies your lungs. Next, we are going to do the triangle, the Trikonasana. The Trikonasana is also said to be very good to keep tuberculosis at bay and strengthen and fortify your lungs. Your feet should be about 3 feet apart. Then the right feet should be turned around as if you're walking off in the right. Lift up your left hand above the head. Gently lower your body, so the right hand is on the floor and you're looking straight at your left hand. This is the Trikonasana. Count 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Slowly come up. This is also very good for your liver and your kidneys and helps, detox your body, helps surgence of oxygen in the body. And we continue with the left side. See, your feet are 3 feet apart. Left feet turned towards outside, outwards. Because now we are going to go down with that left hand. First, right hand up. Up. Slowly go down. Keep your left hand on the floor. Right hand is above your head. Look straight at your right hand. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Come up. Here. If you can't go down that much, go down as much as you can. Maybe you touch your knees, but the other hand is up, pointing towards the ceiling, and you're looking straight at the hand which is up. We will do the cycle once again. Your feet are 3 feet apart. Your right feet is turned towards outside. Hands at shoulder level. Then the left hand is here. While you're looking at your left hand, go down, touch the floor. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Come up slowly to the starting position. Once again. Once again. Here we'll turn the left. You standing 3 feet apart first. Feet are 3 feet apart, pointing straight. Then the left feet you turn outside. Hands here. Right hand above the head. Slowly go down, go down, go down, go down. Touch the floor in front of your left hand. Look straight up at the ceiling towards the direction of your right arm. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. This was the Trikonasana. It is supposed to be an asana that keeps COVID also at bay because it kind of fortifies your lungs. This is the best for your lungs, but also for your blood circulation and your liver and kidneys. The next asana that I show you is the Prasarita Padhana, where you stretch out your body entirely, about 3 feet apart again, and bend and keep your hands on the ground. Then we will do a hip swing. Lift up your right hand, count 1, 2, 3, 4, 5. Keep it on the floor. Lift up your left hand, count 5. 1, 2, 3, 4, 5. Keep it on the floor. Lift up your right hand, 1, 2, 3, 4, 5. Lift up your left, 1, 2, 3, 4, 5. Lift up your right, 1, 2, 3, 4, 5. Lift up your left, 1, 2, 3, 4, 5. Lift up your right, 1, 2, 3, 4, 5. Lift up your left, 1, 2, 3, 4, 5. And we will stretch our legs and stretch more. Keep our head on our hand. This is the Prasarita Padhana, and it is very good for your entire body to fortify your lungs, your respiratory system, your metabolism, and your digestive system. Sinusitis. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So between these asanas, you should actually have very fortified lungs if you can do it every day. We will do some stretches now. If you have any questions, of course, we will do some stretches which helps relax your body, helps relax your abdomen, your chest muscles, and breathing better. Sitting like this on your knees, completely knee sitting, we will stretch out as much as you can and keep your forehead on the floor. This is Shishu Asana, the child's posture, which helps to relax every part of your body and stretch you out. Good blood circulation, good for your nervous system. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. 2 more times to stretch out our bodies. Here we are, stretch as much as you can. Keep your hands firmly here with your stretch, elbows on the floor and forehead on the floor. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. You could keep your forehead on the floor or your chin on the floor as you wish. Once again, stretch out. Here you go. And put your forehead on the floor. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Come up. Next, we are going to do the Surya Namaskar. I'll show you all the steps to do it, because this fortifies your entire body, creates resistance, and is complete by itself. I'm going to break it up into 9 parts. I will show you my version of Surya Namaskar, which is a complete exercise in itself, and even for people who want to do cardio. If you do it 21 times in a day, it is your entire cardio regimen. It's a complete body workout and a complete health workout. So we start with the Surya Pranam. First, in the Namaskar posture, right in front of you. For each of the postures, we are going to count 10. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. From here, we go on to the back bending. Bend as much as you're comfortable and count 10. 1, 2, and 10. Come up and touch your toes as much as possible, whether it's the knees or the toes. Ideally, you should go down on the floor and bring your head towards your knees for a count of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Bend your knees, take it back. Here you go. Feet are firmly on the floor. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Lift up your left leg, bring it in front, and look up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Take it back, stretch, the cat stretch, completely the cat posture. Lift up the left leg, bring it in front, and look up in this stretch. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Take it back, stretch out, rest your knees on the mat, lower your body, but your hips and your stomach, abdomen should not touch the floor. Lower your body so only the chin touches the floor. Here you go. Take it forward, forward, forward. And now lower your abdomen and come up in the Bhujangasana. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Now take up your body. Get to the cat posture again. Count 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Bring your feet up, touching the floor, touching your toes. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Slowly come up into your back bend again. 10. And in your Namaskar posture. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We will do it once again so it's a little more clear. We start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Back bend. And 10. Lengthen your spine and touch your toes, touch your knees or touch the floor. Take your legs almost near your knees. Count 10. Kick your legs behind, the cat posture, the cat stretch. Your ears should be near your elbows. Lift up the right, bring it in front. Look up, count 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Get back to the cat posture, stretch out. The left leg, count 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Next, we get back to the cat posture, stretch, then gently lower your knees on the floor. This is the tricky part of Surya Namaskar. Then lower your body on the mat with your chin touching the floor first, but your hips and abdomen, stomach and your hips remain away from the mat till you get into your Bhujangasana. It is very good for your upper arms and your chest and works out your upper body. See, here we go. Chin down, slowly come up. See, my stomach and hips are away from the floor. Then lower slowly my stomach and get into the Bhujangasana posture. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Slowly get into your cat posture again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Toe touching or touching the floor. Body bend, very good for your liver and kidneys and your lower back. 1, 2, 3, 4, 5, 6, 7, 8, 9, and come up and do your back bend. And your Namaskar in front. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. I think this much has been clear. I'm going to show you the Vajrasana also, which is again very good for your digestion, metabolism, and oxygenation of the body, and good for your lungs. You will sit on your, I'm doing it on the side so you can see it better. You sit on your knees completely, the Vajrasana, and you hold your Namaskar at the back. Hold your Namaskar at the back. Count 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Take a breather for 5 and we repeat it once again. 1, 2, 3, 4, 5. Get back here. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. This was your Vajrasana. Next, we will do some more breathing exercises but with our mudras. The first that I show you would be using your fingertips to massage your fingertips and stimulate your nerves, especially the ones leading into your lungs, into your heart, into your liver and kidneys. And there are ways that just with the Mudra Sutras, one can heal oneself. One is the right hand over left hand, straight lines, and keep it like this. Press towards each other, press one towards the other, and this is the Bhairava Mudra, the right hand over the left hand. The fire mudra, which produces energy in the body, produces heat in the body. Count 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. We will change and put the left hand over the right hand. Press it hard. This is the Bhairavi Mudra, which is very good for your cardiac system in the body. Press it hard towards each other, arms away from the body, shoulders lifted up, no slouch, spine lengthened, and 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. We repeat. Bhairava Mudra, right hand over left hand, body tightened, no slouch, arms up, and 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. The Bhairavi Mudra, 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. We repeat last time. The Bhairava Mudra, the right hand over the left hand. 1, 2, 3, 4. Don't slouch. Keep your shoulders up. Not up like this, but relaxed, but upright. Spine is completely lengthened. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And the left hand over the right hand to balance your chakras. 1, 2, 3, 4, 5, 6, 7, 8, and 9, and 10. Now it's time to relax your body. I think you've done a good yoga regimen. If you can do this every day, it would work wonders towards energizing you, towards making you more productive and much healthier with more resistance towards not only COVID-19, but also towards protecting you from tuberculosis. And as we have discussed for tuberculosis also, it is very important to eat well because you need to feed your body. The food that goes into your body is what breaks up and oxygen is produced to nourish your body. So no fad diets. I'm absolutely against fad diets or starvation to suddenly get into a slimming regimen. Not eating enough food, not eating the right food to reduce your body weight. That is what causes a lot of weakness in the body, and that also causes your lungs to be compromised and the TB virus gets to you. So I would always tell all of you, be happy with your body weight, and if you need to reduce, go into a proper diet with a nutritionist where you lose weight over a long period, 6 months. No fad, no magic diets. No starving your body of proteins and nutritions. No keeping yourself away from food to get to that perfect body shape. Every shape is perfect and you need food to nourish your system. So a balanced diet, a balanced nutrition, along with these exercises, a good yoga regimen and positive thinking will keep you healthy and happy and keep tuberculosis at bay. Thank you very much. Have a great day and see you soon.
Thank you so much, ma'am, for this wonderful session of yours. And we would definitely love to collaborate with you again in the future. Thank you so much for gracing Panacea and giving a kickstart to the morning today. Thank you so much, ma'am. A very warm welcome. We have with us today Dr. Vikram Hude, Senior Consultant Interventional Neurologist. And he's going to present to us a talk about intervention neurology today at Panacea. I welcome you, sir, to the session. And I leave the screen to you for conducting your session right now. And I'll be coming back with a few questions.
Good morning, everyone. So today we'll be discussing about neurointervention or intervention neurology. So what is it about? So you would have heard about brain stroke. So brain stroke or paralysis or LACWA. So earlier there was no treatment available for brain stroke. So and nowadays there are varieties of treatment available. So the main thing is patients need to recognize that they're having a stroke and they need to rush to a stroke ready hospital. So why is it? So earlier there are a lot of myths about stroke, that there is no treatment available, it is an old age problem, and it is very rare. So these are all myths. Okay. So according to World Stroke Organization, 2 years back, 1 in 6 people worldwide will have stroke in their lifetime. So this was 2 years back. Okay. Now recently, the World Stroke Organization has given a new incidence where 1 in 4 people will have stroke in their lifetime. So it is not a rare disorder, it is a common disorder, and all of you should know about the symptoms and what all things are required. So this is one myth, means it is not rare, it is common. So according to Indian study, the incidence is around 135 to 148 per 100,000 population compared to Europe and US. So the incidence is more in India compared to Europe or US. Okay, so that's why it is important for us to know about it, that there is treatment available, we can prevent stroke, all those things. Coming to what are the risk factors for stroke. So there are modifiable and non-modifiable risk factors. I will be talking about modifiable risk factors. We need to control the blood pressure, we need to control diabetes, we need to control cholesterol, stop smoking, and alcohol intake also we need to stop. So these are all the common risk factors for stroke. Stroke, or brain attack, there are two types. One is because of the blockage to the blood flow to the brain, which is ischemic stroke, and it is a common form of stroke. And second variety is bleeding inside the brain, which is called brain hemorrhage or hemorrhagic stroke. Okay, so in ischemic stroke, what happens? The clot from the artery or from the heart, it goes inside the brain vessel and blocks the brain vessel. So slowly that part of the brain will start dying. Okay, because there is no lack of oxygen and nutrients. So slowly there will be expansion of the brain cells where it will be dead. So once the brain dies, or that part of the neurons will die, it won't regenerate. Like for example, if it is a kidney or a liver, if there is a damage to the liver up to 50%, it can regrow and the liver will function normally. Whereas the brain, once the brain is damaged, it won't regenerate. The surrounding part of the brain will take over the function depending on the age. If they are young age, there will be a lot of reserve and they will take over the function, that is called neuronal plasticity. Or the best way is we need to prevent the amount of brain cells death. So how to prevent it? So I will be talking about it. Okay. So once the blood flow to the brain is blocked, you see here, every second we lose 32,000 neurons. Okay. So if the blood flow to the brain is blocked, which is a major vessel, every second we lose 32,000 neurons. So that's why it is important for everyone to recognize the symptoms of stroke and they should reach to a stroke ready hospital. Because if you go to your local physician or your general practitioners, they may not be available 24/7. They may be busy. In the night, they may not receive your call. Then because it is a painless disorder, patients will neglect. And then next day they will go, they may ask them to do a scan where they have to do a scanning center. They have to go to a scanning center and they will lose a lot of time. Okay, by that time, the amount of brain damage is severe and we can't do anything for it. Okay, so that's why it is important that you should recognize the symptoms of stroke. So symptoms of stroke can be remembered by mnemonic B FAST. B for balance problem, E for eye vision or blurred vision, F for facial asymmetry. If you ask them to smile, the face goes to one side. A for arm weakness, S for speech disturbance. They may have slurred speech, they may not speak also, or they may speak excessively. So these are all the common symptoms of stroke. And sometimes if it is because of a brain hemorrhage, they can have severe headache. So if you have these symptoms, you need to rush to a stroke ready hospital, because in stroke ready hospital, they will be having protocols where everything will be done faster. As soon as the suspected stroke patient comes, the patient will be taken first, blood test will be done immediately, and we do a scan to see whether it is a ischemic stroke or hemorrhagic stroke, and we give the clot buster injection if they come within 4.5 hours time, or we can remove the clot from inside the artery. I will be talking about it. If it is a large vessel occlusion, earlier it was just 6 hours time. Now we can extend it up to 24 hours. So that is so earlier we used to give chemical thrombolysis, then suctioning, all those things. Now we have evolved, and from 2015, mechanical thrombectomy has become a standard of care for stroke patients. So I will show you one example. This pregnant lady, she presented with 1 hour onset of weakness on one side of the body. Okay, she did not have headache or anything. She just had weakness on one side. So she was not able to move her left side. Okay, so she is using her right hand to lift the left hand. So then we do immediately scan. Scan is not showing any bleed. So there is a blockage in the blood flow to the brain. Okay, so this is how we remove the clot. So we use a fluoroscopy machine, and from the leg artery we put a small tube into the occluded artery, and then we pass this small wire. They are small wire similar to the size of our hair, and this is the clot which is sitting, and we take the catheter on the wire. We take the catheter, and inside the catheter we put the clot retriever. Okay, so once we put the clot retriever, the blood flow is restored. Now we are putting the clot retriever. Okay, so the blood will start flowing through the clot, and we wait for 5 minutes time, and after that we pull the clot along with the clot retriever. So this is, once we remove the clot, blood flow is restored, and we can save large part of the brain if you come early. Okay, so if we save large part of the brain, the recovery will be faster, because there will be a lot of reserve nerves, and the recovery will be faster. So this pregnant lady who presented with weakness, earlier there was no option available, and she would have been bedridden. And now you see this is the DSA which is showing the vessel was occluded. So this part of the brain was not receiving any blood. And we put the clot retriever and opened this. You can see now it has opened beautifully. Okay, now blood flow to the brain is restored. And you see within 24 hours, this patient is able to lift the hands and legs. Okay, and in 3 days time, she delivered also, and she is holding the baby, and she walked home. So this was like a magic or miracle in neurology. It was not possible earlier. So now we can do this type of treatment. So that's why it is important for everyone to know about mechanical thrombectomy. Okay, this is one type of treatment. So we all in medicine, allopathy, we believe in evidence. Okay, so the number needed to treat is important to know how much effect the treatment will give. For example, we give aspirin for heart attack patients. So if we give 50 patients aspirin, it will help one patient. Okay. Similarly, you would have seen shock for cardiac arrest patients. If they have ventricular fibrillation, they give shock. So in all movies, you would have seen one shock is given and patient suddenly wakes up. So that also, the number needed to treat it is around 2.5 to 3. Means if you give shock to 3 patients, 1 patient will get benefited. Similarly, if we see mechanical thrombectomy for stroke, the number needed to treat is just 2 or 2.5. Means if you treat 2 patients, then 1 patient will get benefit. So that is how strong the evidence is. This is one of the strongest evidence in medicine. Okay, so that's why you should know which is your nearest stroke-ready hospital, what are the symptoms of stroke, and you should circulate this to your friends also. Okay, now coming to hemorrhagic stroke. Okay, in hemorrhagic stroke, what happens? Because of high blood pressure, that is a common reason, the blood vessels inside the brain will burst, and that will cause severe headache, vomiting, patient will lose consciousness, and they can have seizures also. So this is a different type of stroke. So earlier what I told is ischemic stroke, where there is a blood flow blockage. Here there is a burst of blood vessel. The common reason for hemorrhagic stroke risk factor is high blood pressure. So there is a general myth that BP will produce symptoms, high blood pressure. So sorry, if it is mild to moderate high blood pressure, it will not produce any symptom. When it is severe, when the BP goes up very high, then only symptoms will develop. So that's why it is important that you need to check your BP regularly and take medicines to reduce the blood pressure. So there is one more type of brain hemorrhage which we can treat endovascularly. That is because of the brain aneurysm. Aneurysm is bulging of the blood vessels of the brain, and that can burst, and it can cause hemorrhage in the space between the brain and the skull. That is called subarachnoid hemorrhage. That is also the prognosis is bad. Better we need to treat them early. So earlier the surgery, open surgery was the only option available. Now we can do endovascular treatment, which is a minimally invasive procedure, where we put a small tube from the leg artery inside the brain artery. Okay, so these are all small tube we put inside that bulge, and then through that we put coils. So these are all platinum coils, very soft, and we put many coils inside the aneurysm so that the clot will form, and the risk of rupture is not there. Okay, so this is what we do once we get an aneurysm which has ruptured. So nowadays, before rupture only, the aneurysm is treated, because the aneurysm is formed because the vessel wall is weak. That's why there is a bulge. So nowadays we put a flow diverter across the neck of the aneurysm if it is diagnosed before the rupture. So this is how we do coiling, endovascular coiling. And for all these things, we require high-end, high-resolution machines, fluoroscopy machines. So because these are all 4 millimeter, 3 millimeter vessels, so high-resolution imaging or fluoroscopy is required. We have a dedicated neuro cath labs. There are cardiac cath labs, the resolution is not that high, earlier one. And we have a dedicated neuro cath labs. And nowadays, artificial intelligence has come in imaging, and it will help us in deciding the patients who can undergo thrombectomy and who will get benefit for patients up to 24 hours time. So again, this is because of the advance in engineering and artificial intelligence. This is possible. Okay, so coming to how to prevent a stroke. So prevention is the best way to treat a stroke. So we need to control our blood pressure, we need to control our sugars, we need to control cholesterol. You should do exercise, regular exercise, healthy diet, and you should stop smoking. And these are all the preventive measures for brain stroke. So to conclude, we should know that stroke is a preventable and a treatable disease. If you have a stroke or see any person having stroke, rush him to stroke ready hospital, because every second counts. So that's why it is called time is brain. Please spread this message and save a life. Thank you.
So, it's a really wonderful presentation which you presented, and would really like to thank you for that. So we have a few questions that if you can talk a little bit more about the imaging and the radiology process in neurology, which is and how India is being impacted on it. How India will be, developing. The country is going to be developed for the for taking in AI and radiology imaging in neurology.
Yeah. See, earlier, before CT or MRI era, how stroke was diagnosed, they used to do lumbar puncture, and if blood used to come, then they used to think that it is a hemorrhagic stroke, otherwise ischemic stroke. So then CT was invented, and MRI. So it changed significantly. So now we are able to differentiate ischemic stroke, hemorrhagic stroke, why the stroke has happened, all those things started coming. And then slowly other treatments started, like IV thrombolysis and endovascular treatment, all those things started. Now with artificial intelligence, for example, rapid or many other things are coming now. So we can identify, for example, in our center, which started the first artificial intelligence based imaging for stroke in Asia in 2017. From 2017 we have. So once the scan is done, we push the scan to the server, which is there inside the hospital, and we get the report with the images to our mobile phone in 5 minutes time. So otherwise, the radiologist has to get up, he has to see the scan. It would have taken 1 to 1.5 hours time to analyze the perfusion scan. Now, the AI will help us 24/7. We can get the images with the report in 5 minutes time. So I think that is a significant advance which will help and benefit the patients for stroke. And now softwares are coming to identify hemorrhage. I think in future, even for the brain tumors, demyelination, I think slowly AI will help the radiologist to report the patients, to get the report 24/7, because the radiologist who report the scans, they're very limited. So they may not be available in the night, and so that's why in that way it will help significantly.
If you can also, sir, tell us that what about the management of the neurological disorder, in especially because especially in aged people right now during the pandemic, and now we also know the second surge is coming, and a lot of cases have been coming up now recently. So, how important is the management of the elderly during this pandemic?
Yeah, I think so. If a patient has got neurological disorders, and it depends on what type of disorder. For example, if a patient has a stroke and he's on medicines, it is important that they should not stop medicines, because if they are not able to see a neurologist, so now various alternative options have come. You can do virtual consultation, and you need to do regular blood test in the nearby lab, so that your risk factors are controlled. So these are one things. And now I think with the corona vaccine, I think if a patient is on antiplatelet, even now government has told that they can take a COVID vaccination. But if a patient is on oral anticoagulation like acetylene or warfarin, then you should be careful. You should consult a cardiologist or neurologist and then take the vaccine.
And sir, if you can highlight a little bit more about the children, because it is an age-related process. It's an age-related neurological disorders are cropping up more and more in people. So, how children are going to be affected, and how what can be the management of of holding it back till the time they can't express, and they can't the treatment can be done. So how important it is to aware the
No,
children also.
I didn't get which disease.
So management of children during this pandemic, and how to hold back the neurological disorders which are cropping up a lot in India right now. If you can have some tips to share with us, sir.
See, I means neurological disorder because of COVID in children, or
No, so during pandemic itself.
disorder with during pandemic.
Yes, yes,
I
yes.
think
The
now
management of neurological disorder basically in children as well as elders. So I'm just asking the children how.
compared to last year March, when there was lockdown happened and everything was uncertain, then no one used to meet a doctor, or we were also afraid of meeting people, and virtual we used to do. So nowadays we know a little bit about the disease, and with vaccination and everything, now people have started coming to it has become near normal, but now second wave has started. I think that's why it is important that more and more people should get vaccinated. For kids, till now the vaccination is not approved, so they can do video consultations and control their neurological problems.
Absolutely, so I agree to that. So, if you have any other parting note on the session on intervention neurology, which you want to convey to the mass, and because everybody is watching us and they are watching us live, there are a lot of viewers who are watching us. So, if you can say a few words about the future of neurology in India, and also the kind of situation the country is going through, the globally actually is going through. If you can just say a few words on it.
Yeah, so now many neurological disorders there is treatment available. So one of that is by in neurointervention or intervention neurology. So we can treat many neurovascular disorders, not only ischemic stroke or hemorrhagic stroke. If there is a blockage in the blood vessel, we can do carotid stenting. If there is a blockage inside the brain, we can do intracranial stenting. Some conditions which can cause brain hemorrhage, similar to aneurysm, like AVM and dural fistula, that also we can treat endovascularly. And some vascular tumors, during surgery, they may bleed. In those patients also, we go inside and block the blood flow to the tumor, so that for surgeons, it is very easy. It is almost like excessive bleeding during surgery to bloodless surgery. So that is also possible. If they have problems in the spine, dural fistula, spinal AVM, spinal fistulas, vertebral body hemangiomas, all those things can be treated endovascularly. Even recently, we have started doing venous stenting for intracranial hypertension. All those things, the technology has evolved, and so earlier there was no treatment for these disorders. Now a lot of treatment is available. So that's why it is important that you should know the symptoms of these disorders. At least you should remember the mnemonic "Be fast," and you should reach a stroke-ready hospital as soon as possible.
Sir, thank you so much, sir, for your time and for this wonderful session on neurology. We'll definitely get back to you, and please write for us, and if you can contribute for our blogs, for our website, it will be really great, and it will reach out to a lot of people who are having a lot of questions regarding this particular subject. Thank you so much, sir, for taking the
Sure,
occasion.
thank you very much for the opportunity. And our hospital, we have many subspecialists, and all are willing to create a public awareness about the various neurological disorders. We have pediatric neurologists, movement disorder specialists, epilepsy specialists, neuromuscular specialists. So in neurology also, there are many subspecialists.
Right.
Thank you.
Absolutely.
Good morning, Dr. Basuraj GS.
Can you hear me?
Thank you so much for joining us.
Yeah, hi, good morning.
Good morning, sir. Thank you so much for joining us. My name is Harshal Desai. I'm part of editorial
I cannot
team.
hear you. I'm really sorry, I cannot hear you.
Am I not audible?
Yeah. Now it's okay. Yes, tell me.
Yeah, okay. So thank you so much for joining Panacea today morning on this amazing Sunday. We thank you for agreeing to participate in this program. Just wanted to brief you. We are organizing 4 sessions today, and we had one on yoga by Ms. Sohini Roy Chaudhary, and we also had a session by senior consultant interventional neurologist Dr. Vikram, who did just now. And now we are going to have the 3rd session. I would like to tell all the audience that this session is being conducted by Dr. Biswaraj GS. He is consultant, Department of Diabetes and Endocrinology at Narayana Institute of Cardiac Sciences. So, Panacea, those who have recently joined us live on our social media platforms and on our website would like to again update them that this is an event which is sponsored by Mylan, a Viatris organization, and conceptualized by eHealth and eLets Technomedia Private Limited. Panacea is a 6-month long campaign where we are trying to bring experts from across the country on this platform to talk to people who probably have recovered from COVID but are not able to cope up with its after effect, and people who are at the risk of developing the disease, uh, people who are working in the front line. We are all witnessing the second wave of COVID-19 across the country, and in times of this pandemic, it is very essential for us to understand how we can protect ourselves from this disease. And with this, I would like to hand over this virtual dais to Dr. Basuraj GS for his session. Over to you,
Thank
sir.
you. Thank you. Thank you, Arshal. Thank you. And thank you, Team Panacea, for giving me an opportunity to speak up on this distressed days wherein we are facing the pandemic. Or rather, I would rather say that rather than distress, we would rather put it in a more hopeful way for a better future with so many vaccines available and with wide access to the vaccines which have been available. So thank you again, Tim Panesia. Thank you, Whiteridge Division, for conducting such an initiative. I feel this is the need of the hour. This is the need of the hour to get those people back on stage, to back with their life rolling and trying to keep up with the pace of the challenges which life puts in front of them. So all in all, what I would want to start is hope. Hope is the driver. Hope is the engine which drives the life, which drives the car called as life. So I would say never lose hope. So always there's a bright Sunday. Always there's a beautiful morning. Always there's cool air in the breeze. Always there are so many positive things to be looked forward to. So with this, what I have been given the opportunity to speak on certain things related to COVID-19, the SARS-CoV-2 virus, the pandemic in which we are all in, and the tuberculosis, the very old, good old, known, sort of very familiar word, I would say, tuberculosis, which we will be dealing with. So what we'll be taking together is that how endocrinology and COVID are related, and what I would be trying to deal is how and what are the causes which is going to affect you, how it is going to affect a general person who is suffering COVID-19 or who has recovered, or people who are fighting in this pandemic era of SARS-CoV-2, and what it means to the people, the COVID-19 and the endocrinological diseases, what to do to prevent any of these diseases. We all know that social distancing, masking, and use of sanitizers are the key role for any of this prevention. Whenever I speak of prevention, are the key roles in preventing any of these things, and what to do in with respect to any all of these endocrinological diseases if you get infected, and how to manage is what we would be dealing with. So, when speaking of endocrine system in the human body, what we understand, or what general public understand, is that it is something to do with only diabetes or thyroid. Probably what I would like to say here is that endocrine is a wide gamut of mm, organs in the body, and the master gland, what we call, is the pituitary gland. Then we have got the thyroid, which is a butterfly like gland which is sitting in the neck. Then we have got other endocrine, pancreas. We have got bone health is also considered as one of the part of endocrine perspective, or within the spectrum of the endocrine diseases. Then we have got gonads, then the male gonad, the testes, and the ovaries, and we have got many other endocrine organs, be it your hypothalamus and the adipose tissue, many others. So it's a wide expanding horizon for endocrinology as a stream. So what will be now, what do we mean by the word endocrine? Endocrine is something which secretes a hormone, an organ. Endocrine organ is something which secretes a hormone, and this hormone is released in the blood. It acts, but the target organ is somewhere else, and it is secreted somewhere else, and it takes the route via the blood. So blood is the carrier for these hormones. So that is the word meaning of endocrine. Endocrinology as a discipline deals with the study and the management of the diseases involved with these endocrine systems. So the most common endocrine diseases which we see in and around, one is your diabetes, any form of diabetes. The most commonest variety which we see nowadays is the type 2 diabetes, and the other lesser common is includes your type 1 diabetes, the maturity onset diabetes in the young, the latent autoimmune diabetes, and so on and so forth. There are many other lesser known or lesser prevalent diseases of diabetes, variants of diabetes which are there. So then again, the second commonest disease which we call is your thyroid diseases, be it your hypothyroidism, primary, subacute Hashimoto's, and then you've got your hyperthyroidism, toxic goiter. Then we have got your goiter, the enlargement of the thyroid gland, and then we have got there are some diseases of the thyroid which are called as thyroiditis per se. So all these things taken together, predominantly the major diseases of the thyroid gland. And then we have got obesity, which is again probably has reached up one of the, it will soon reach up as a non-infectious epidemic, something like that, and the prevalence is increasing. Then we have got the adrenal diseases, then we have got the gonadal diseases, all these things which we have already seen through. So now I'll take up all of these individual diseases individually and how these things are affected with COVID-19 and probably tuberculosis also. So diabetes, we know that diabetes, almost 10% of the Indian population is suffering from diabetes. Further, 18%, roughly around 18 to 20% have almost pre-diabetes and diabetes. And this is our own very Indian data, which I'm speaking of. So going forward, with such a high prevalence of diabetes, we also know that the chance of having a morbidity or a mortality, that is, chance of having any complication because of the COVID disease, the COVID-19 disease, and the involvement of SSR, severe acute respiratory syndrome, that is almost a very severe form of the COVID-19 virus infection. So all of this severity increases, and we also know from the scientific literature that the death rate in patients suffering from diabetes in COVID-19 along with COVID-19 infection is almost 2 to 3 times. It does vary from country to country, geography to geography, and given the circumstances plus many other things, the medical facilities. So the chance of mortality is higher by 2 to 3% in these set of patients. So what sort of diabetes is it more common, or do they have more complications? No, any form of diabetes is supposedly same, be it your type 2, be it your type 1, or be it any form of diabetes, it is all the same. All right, so now we know the effects of the morbidity and mortality. So it is very, very important for the people with diabetes to have a good control of their sugars to prevent themselves from getting COVID-19 infection. So good control of your sugars with a good A1C, with a good fasting and postprandial plasma sugar, or whatever means they check or they do monitor their sugars. Please do monitor and get your get your sugars controlled, so that your chance of getting infected also is on the lesser side if you have a very good control of your sugars. And even though in the worst case scenario you get infected, you are unlucky to get infected, then a good control always saves you from having more complications. So you'll be just an asymptomatic or mild symptomatic in majority of the cases if you are in a good control state. So what we need to also understand is about the type 1 diabetes. These are the patients who are on insulin and who cannot live without insulin. They need insulin for the survival because their body is not able to produce any insulin at all. So in such circumstances, insulin is of paramount importance. Even if you skip 1 or 2 doses, they'll end up in complications which is known as the DKA, diabetic ketoacidosis, which can be life-threatening. So all of these things taken together, what we need to understand is about the sick day rules. When the patient is very sick or he is feeling that, so you need to contact your medical practitioner, need to frequently check your sugars, do not skip your medicines. If your sugars are okay, if you're feeling vomiting, please consult your medical practitioners. Do not skip any of these advices which are being given by the medical practitioner. Now, again, going forward, during the initial days of the lockdown, where there was again a problem with even some of the type 1 diabetes patients, where the availability of insulin was an issue, but most of the patients were able to get the insulin required for the management of the type 1 diabetes. So also we must understand that there are certain type of drugs which are given during the recovery, for a faster recovery or a quicker improvement in their disease of the COVID-19, which are called as the steroids. The dexamethasone, which is commonly used, can cause diabetes also, which we call as dysglycemia. Even COVID-19 per se can cause stress hyperglycemia. So these are all the various interactions involved with your diabetes mellitus and your COVID-19 diabetes. And because people who have been treated with your steroids, that is your dexamethasone, can lead to a diabetes in the further stage also. Please remember, if you are a patient who has already suffered COVID-19 disease, to always talk to your healthcare medical practitioner and ask them to provide and discuss with them your chances of having diabetes, and please get all of these things tested. So now coming to the second endocrine disease, which is probably the obesity, that is your high fat mass, with the overweight, what we call in layman language. Obesity, probably there's increased risk of having the person having diabetes mellitus, and that per se increases the risk of what we call as alveolitis, destructive alveolitis. In these patients, probably in them also there is some data that the risk of having a complicated COVID-19 infection is on the higher side. So again, one of the more important or the more contrasting feature of the obesity is undernourishment. So what we see is COVID-19 is a very catabolic disease. It gives you lots of malaise, lots of generalized not being well, generalized unwell feeling, and malaise, pains, body aches. All of these things are there because it's a viral disease which affects almost all of the organ systems in the body. So, and this being a very catabolic state, hyporexic disease, we call this. So, this requires a lot of your nutritional supplements. So, what we usually suggest is around 20 to 30 kilocalories per kg per day, and almost 1.5 high protein diet. That is your 1.5 grams of protein per day in a normal patient who doesn't have any of the diabetes or any other illnesses. So, this is the usual requirement. They need a lot of nutritional support for recover. So once we are speaking of the nutrition, we must also make sure that the patients are on good adequate supplemental doses of vitamin D for normalizing their vitamin D status, as majority of the Indians have vitamin D deficiency, and there's certain role of vitamin D and in the immune system towards fighting of the COVID-19 diseases. Plus, we also should make sure about the good intake of our all the healthy vegetables and the fruits, which have to be taken along with a good source of vitamin C also. So now speaking to other lesser causes of known involvement of thyroid diseases. Thyroid diseases, most commonly what we see is your hypothyroidism, where the people are taking a thyroid supplement medication. Early in morning fasting is what we tell usually. Empty stomach, keep a gap of 30 minutes and then try to take it daily. Be very regular with your medicines, be very compliant with your medicines. That is what we always tell with primary hypothyroid patients. Again, on the contrasting side, we have the hyperthyroid, where the metabolism is quicker, where the metabolism is way to excess that of what we usually want it to be. In these cases, that is what we call as hypothyroidism. There we give certain medications to control those hypothyroid state and try to achieve try to achieve a normal thyroid state. All of these things and the management of all of these diseases do not differ significantly in a patient who has had COVID-19. Yes, we can have certain things called as your CK thyroid state, central hypothyroidism, and thyroiditis also. Thyroiditis is a very well-known factor now in patients with COVID-19 diseases who have had COVID-19. There can be some temporary inflammation of your thyroid, leading to a transient, again temporary hypothyroid state, where the patient can present with tremulousness, weight loss, malaise, and palpitations with tremors also. So all of these things, please talk to your doctor, please talk to your healthcare practitioners and they can assist you in providing all of these treatment for all of these diseases which are involved with the thyroid, and they can have a check, and then they can probably adjust. And then again, coming to the lesser known factors like your adrenals. Adrenal is a small gland which is sitting over the kidney, and they produce the very important hormones called as corticosteroids, middlecorticoids, catecholamines. And so there is some data that there is some scientific data that probably the adrenal level, the steroid levels in the body are lesser because of the COVID-19 and because of the inflammation which it causes, and hence the levels are on the lesser side. So probably in these conditions, it is again the treating team which decides on whether they need a replacement of the adrenal steroids or not. And then we'll come to the lesser involved organs, endocrine organs with COVID-19, be it your gonads, be it your male gonad, that is your testis, and be it your female gonads, the ovaries. Because of the COVID-19 and the catabolic state, there are chances that female patients can have sort of a bit of disordered menstrual cycles. So not to worry, consult your gynecologist. Nowadays, there are again virtual platforms, plenty of virtual platforms which are available. You can use NHCare app. The newly developed NHCare app can also be used with the benefit of having an online consultation with all the specialists and the super specialists at your dispense, at your own room. Just what you need to have a good gadget and a internet providing mechanism which can give you a good access to these things. So now, apart from the gonads, there is something called involving your bone and osteoporosis. Patients who have had recurrent fractures, meaning time and again they have been having fractures with some trivial falls. They slip, they fall, and then they have a fracture. So such kind of patients, they get evaluated, and what we call the disease is called as osteoporosis, where your bones are brittle. So such kind of patients are on also regular medications. So please do not stop these medications. Make a virtual consultation, because whatever good thing you have achieved over longer term of almost 2 to 4 years or before, usually we treat for 5 to 8 years or 10 years also in these patients. So this is a long-term disease which needs certain kind of addressing the issue. So them also, please do not stop any of the treatment, because then again you'll have to, whatever gains we have achieved by giving the treatment will again probably will be mitigated, and then we need to overlook again. So please contact again your healthcare provider for the management of all of these things. And patients with your endocrine tumors, or be it any of your other endocrine diseases, please do consult with your healthcare provider on a regular basis. Then again, one of the most important things what we have seen in patients when they are admitted during COVID-19 is what I have spoken as your stress hyperglycemia or steroid-induced diabetes. We do give certain medications called as your dexamethasone or hydrocortisone for refractory shock. Usually it's a dexamethasone what is given. So there usually the sugars, the blood glucose levels jumps up on the higher side, and then so this is usually on a temporary basis. The most of the patients do return back to the normalcy, but patients, if they do not return back to normalcy, then probably we need to treat them. Please follow up your healthcare provider, get your blood test done, and then you can know whether you do have gotten into the state of diabetes mellitus or not, or what has to be done. Only just the nutrition supplementation and exercise, or do you also need certain medications is what has to be taken. Now, during these admitted patients, we have also seen certain things called as your central hypocortisolemia and your central hypothyroidism. So almost in one of the studies, almost more than 2/3 of the patient had steroid deficiency when they were admitted with SARS-CoV-2 infection. This can be because of the direct infection, because of the inflammation, because of so many molecular mimicry. So many mechanisms have been proposed for how this could have been happened. So the most important point is, in that cases, you always have to follow up with your doctor. In cases if you see some word like hypocortisolemia in your discharge summary or anything of that mention, then probably you need to follow with your healthcare provider to get it ascertained, to get it checked, to get it evaluated, and to get it treated, so that you have a very good quality of life per se. And there's also central hypothyroidism. It is something similar to the primary hypothyroidism affecting the thyroid gland, but the problem is not in thyroid, then the problem is in the pituitary gland. So then again, it can be detected by certain blood tests, so that your healthcare provider will be taking care of, can approach your healthcare provider, then whatever deemed necessary, the blood test or anything can be taken. So now again, we'll go back to the one of the very oldest known diseases in India, the tuberculosis, which is caused by Mycobacterium tuberculosis. And one of the, we have got a national program, the RNTCP program, still running. And with the emergence of multi-MDR tuberculosis, multi-drug resistant tuberculosis in India, we must make sure that patients with tuberculosis stick to their treatment regimen and be very, very, very compliant with their regimen, with their treatment of tuberculosis, which has been started. Tuberculosis has been sort of an endemic. Quite commonly, what we see tuberculosis in India, and we see a wide variety of picture of tuberculosis in India. Now coming to talking to tuberculosis and endocrine diseases, oh, very, very interesting. Tuberculosis can affect anything and all endocrine organs of the body. It is known to affect all the endocrine organs of the body. So now, most commonly, what is again seen is your adrenal involvement. So there's quite a good quality data, scientific data. What I mean that which shows that from India, which shows that the adrenal steroid levels are quite lesser in patients who are having adrenal tuberculosis. So they need to be on supplementations for quite good some time till your adrenal gland recovers. And then probably this, once your doctor, your healthcare provider sees you and he feels that your adrenal glands have recovered, he'll be usually pulling off the steroidal support, which what has been given. Then again, what we call as the tuberculosis and the endocrine diseases, next thing which is coming to mind is your hypothyroidism, where your blood levels of your calcium go up. So because of certain pathways which activate vitamin D and increases your absorption of the calcium from the gut, so then your blood levels of your calcium go up significantly. So it has got definitive treatment. Please do consult with your healthcare provider if at all you are suffering from tuberculosis and you do have higher levels of your calcium level. Please talk to your GP or medicine specialist, or please drop down to any of the endocrinologists at Narayana or wherever you're comfortable, say center of choice. Please drop down and please inform your healthcare provider of the week. So then again, very, very peculiar thing which is observed in patients with tuberculosis and is your hyponatremia. That's your low sodium levels. What we tell it can be because of the tuberculosis. What we call as your SIADS, the diagnosis is syndrome of inappropriate antidiuretic hormone secretion. So that can cause your low sodium. With this, patients having low sodium, they can have some giddiness, some nauseating feeling, some vomiting, and in most severe cases, they can have a depression of your consciousness. They're not very much oriented, they're confused, and they can also go into a deep, deep, deep state of coma. So then again, we have got your direct involvement of your tuberculosis with your pituitary gland and your thyroid gland also, which can cause certain abscesses, and they can cause granulomas, pituitary granulomas, and your thyroid gland granulomas are also there. So all of these things can be there with the involvement of tuberculosis. Before I end my talk, then the most important thing now what we have observed is during the pandemic season is that we need to have an access to our healthcare provider. So physical access is quite difficult and quite risky. Please do use the video consultation platforms or any of these virtual platforms which are there, so that you can discuss your concerns with your healthcare provider, with your specialist, the super specialist, with the ease at sitting at your home and not risking out yourself, and thus overall helping towards the control of the pandemic, making your contribution towards the control of pandemic by not venturing outside, especially definitely never without a mask and without maintaining a social distancing. Please go ahead and take all of your vaccines if you are eligible. We had a good talk by Dr. Vikram Uday just before I finished about the vaccines, and your COVID-19 diabetes patients are again in the priority list of what the GOI, Government of India, has recommended. So they are on the priority list. Please go ahead and please take your COVID-19 vaccines and get yourself immunized for this. And with that, I think Harshal, I'll be winding up my.
Thank you so much, Dr. Baswaraj GS, for those wonderful opinion that you shared on this platform. I would like to ask you one question. Vaccination is going on around the country and around the world, and people who are suffering with diabetes or obesity or any other disease, they do have this question in mind that should they go for the vaccination or not. So
Please,
if you can
please
please
go for it.
in few words, if you can please guide those people who should go for the vaccination and who should wait, who should be holding this process. If you can please guide this also in about 2 to 3 minutes, please.
Yeah, definitely. See now about the COVID-19 and the vaccine and patients suffering with diabetes. See, one thing we must understand is that we are quite lucky as compared to the other less lucky people around the globe who do not have even access to the vaccine. So, being in a country where you have access to the vaccine, please go ahead and take it, and please utilize the vaccine chance whichever is given to you. Now, coming to the diabetes and COVID-19. See, diabetes has been added as a priority list with age more than 45. After April 1st, the GOI has said that probably anyone more than 45, irrespective of comorbidities, is going to get vaccinated or is eligible to get vaccinated. Now, before this, that is in the current state, anyone more than 45 with comorbidities. What we mean by comorbidities? With any of the diseases which puts them at risk for infection of COVID-19 related complications, they are added in the comorbidities list. So, Government of India wants to protect them first, those who are at the risk, at high risk. So, these are the set of patients population who by vaccinating it will be very useful for them. Now, type 2 diabetes patients, or be it for the matter, any of the diabetes patients with the duration of more than 10 years, and with any of the comorbidities, be it your hypertension, be it your any of the heart diseases, or be it any of your kidney related event, or any of the smallest of the complications with the diabetes which is seen, is a comorbidity list. So that means Government of India is very clear that they are the high risk patient population which needs to be vaccinated. Now, coming to the safety concerns of this vaccine, should I take it? I am a patient with diabetes. Do I have an increased risk of any of the complications with vaccine? See, I'll speak up the data now. So there was this Pfizer data set which had almost 8 to 9% of the patient population that studied were diabetes. And in the similar range, almost all of the data sets of the vaccine population is having patients with diabetes, almost around to the tune of 10 to 12% of their patient population. That again goes with the prevalence of diabetes in our society. In our society, diabetes patients, if you take 100 people, then 10 to 12 people will be diabetes. So almost in the similar range also, the study set has also been designed in that way. So in those, there has been no evidence of having any of the increased complications or increased risk or any of those adverse events as compared to that of people not having diabetes. So it is, the risk is same for any of these complications. Then when we speak of any of these complications, they are very minimal. Okay, they are once in a lakh of probably a more rarer event. So please do not go heed to the negative news what you hear. I have been vaccinated. Almost all of the doctors in the Narayana group have been vaccinated. Our nursing staff, the frontline workers, everyone is vaccinated. Dr. Devi Shetty himself is vaccinated. So all of us are vaccinated. It is absolutely safe. Many of my diabetes patients have been vaccinated. Quite a bit of them, even there will be some of them I have seen also with the second shots getting very recently. It is all very safe. Please go ahead with the vaccine. Please go ahead with the vaccine and have your constructive role in the management of the pandemic.
Thank you so much, Dr. Baswaraj GS. So that's all for today, and we once again, on behalf of Panacea, Viatris, eHealth Magazine, and eHealth Sector Media Private Limited, thank you for sharing your views on this platform. I request all the audience who are watching us live, if you have not been able to view it live, you can always log into our website and view the view the talk again, you can listen to Dr. Basuraj GS on our website as per your convenience, and you can also ask question later on. We would be more than happy to connect you with Dr. Basuraj GS. So thank you so much, and thank you so much for the time, sir. And now we are again, we'll have one more session by Dr. Santosh Gupta. He is State Tuberculosis Officer at Government of Uttar Pradesh, and through Panacea, we have also highlighting the management and bringing experts from the tuberculosis uh, ecosystem from the tuberculosis domain to on this platform to educate the masses on tuberculosis as well along with COVID-19. So thank you so much, and we would now invite Dr. Santosh Gupta on this platform for the talk.
A very warm welcome, everyone, at Panacea. As everyone knows, now we are working on TB awareness initiative. We have with us today Dr. Santosh Gupta ji, State Tuberculosis Officer, Government of Uttar Pradesh. I welcome you, sir, to the show. Sir, if you can say a few words about how the UP government is working on the tuberculosis scenario right now, and about the current scenario and the success which UP government has given on working about tuberculosis. So, if you can please elaborate on it.
Yes, you must be aware regarding the unique place which UP has as far as the TB elimination is concerned. You must be aware that every fifth patient of the country is from UP. So the challenge is big, but the government of UP is fully committed for elimination of TB as per the timeline prescribed by our Honorable Prime Minister. On 1st November 2020, Honorable Chief Minister UP has unveiled the strategic plan of the state for TB elimination. This plan will be focusing primarily on the large-scale community participation, interdepartmental coordination, and expansion of various services being provided to the patients of the state. We are continuously working on expansion of services for expansion of laboratory services, as well as the services required for treatment of drug-resistant TB. So these are the various aspects on which right now we are focusing for eliminating TB from the state.
Sir, if you can enlighten us about what is causing tuberculosis to become a serious public health problem, sir. If you can elaborate on this.
Sure. Tuberculosis is quite rampant in our society, and it is there since ages. It's not a new disease, it is there since ages. Concerted effort for elimination or for control of tuberculosis have not yielded desired results in the past. But now we are more focused. And in fact, this is a disease which needs a lot of community participation. We need to generate awareness among the masses for elimination, for prevention of TB. We have to make aware the masses that what are the presenting symptoms, when they should approach the health facility for getting the diagnosis made, and once they are diagnosed, what precautions they should take to prevent the spread of disease to the persons who are in close contact with that patient, and what is needed from that patient. Like the adherence to the treatment is very important for tuberculosis treatment, because you must be aware that the duration of treatment for TB extend from 6 months to 2 years. And once the symptoms improve, then patient have less inclination to continue with the treatment. We need to emphasize to them that you need to complete the treatment um, um, uh, as per the prescription given by your treating physician. So these are the various aspects on which right now we are working, and I hope that working on these various aspects of the disease will certainly lead us closer to the TB elimination. There is one more aspect that is related to the comorbidity. Persons who are having diabetes, persons who are having HIV infection, or those persons who have lower down immunity due to some other reason, maybe due to some other underlying disease, or maybe due to some treatment undergoing. All these persons, they are more vulnerable to tuberculosis. And these factors become very important to get the successful outcome while treating these patients. So we are focusing on all these aspects.
Sir, if you can tell us about how is the government doing with the testing of people with HIV, basically for tuberculosis?
In UP, all the district TB officers, they are designated as district AIDS control officers also. So it becomes very easier for the same person to coordinate the activities related to both the programs. And the first thing is that we test each and every patient of the state for HIV infection. The kits for these testings are being made available by the AIDS control organization. UP SACS is making these kits available, and our officers are supplying these kits to various health facilities so that each patient is tested. And once the patient is tested positive, then he gets treatment for both the diseases simultaneously.
Right. Sir, if you can elaborate more on the supply chain management, which the government is doing right now for tuberculosis, reaching out to all the Anganwadis, how the supply chain management is working regarding TB, sir?
Like in the state, we are having 4 designated drug stores, uh, and the state supplies drugs, anti-tubercular drugs, to these 4 stores, and from these stores they are supplied to the linked districts. And from once the drug reaches to the district, then it is supplied to various tuberculosis units. From there it is provided to the patient and treatment supporters. So this is the entire system. This is a well-built system, and we have a Nikshay Oshadi portal on which we manage this supply chain across the state.
Sir, if you can also enlighten us about, tell us about the policy interventions of the state which is being done. That will be like, what are the policy interventions which are doing, like the ad campaigns? What kind of campaigns the state government is doing for tuberculosis, and how important it is for campaigns to run in the state for majorly awareing the mass.
You have asked 2 things. I would like to respond to your query regarding the policy changes. Like,
Policy.
lot of enabling changes are being made in the policy. You must be aware that significant number of TB patients go to private sector. There is a gazette notification which has made it mandatory for all the private practitioners, private hospitals, chemists, and whosoever, or including pathologists, if they are diagnosed diagnosing or treating a case of TB, then it is mandatory for them to notify it to public health authorities of the district. This change is there. There are some policy changes related to the development of infrastructure in the medical colleges. Like there is one circular which makes it mandatory for all the medical colleges that they should have a diagnosing facility. They must at least establish a designated microscopy center. They should have some basic infrastructure for treatment of drug-resistant TB. So this kind of several changes of this kind are being made at various levels so that the patient can avail these services close to his place. We are trying to reach as closer to the patient as possible. And then you have asked regarding the campaigns. Yes, campaigns do have their own importance. Time to time, we identify some of the gaps in the performance. Like UP is a state with enormous size. We are having 75 districts. And it becomes very challenging for us to implement the program with same quality across the state. Whenever there are some gaps, we identify those gaps, or we, as per the need of the program, we run these campaigns. We call them active case finding campaign, or some other campaign is designed. Just to give you an example, that from 26th of December 2020 to 25th of January 2021, we had a campaign with the name of TB Harega Desh Jeetega. TB Harega Desh Jeetega campaign. And we divided this campaign in 3 parts. For the initial 1 week, we focused primarily on closed settings like prisons, old age homes, orphanages, Nari Niketan. We focused on these settings. Our teams went to these sites and conducted the symptomatic screening of all the inhabitants. And in the process, we got significant number of cases. Then phase 2, we had active case finding campaign in which our teams went house to house across the state. And in the process, we covered 20% of the population of the state. And in phase 3, we conducted a drive for contacting all the private practitioners, all the chemists of the state. And during this 1 month campaign, we could identify about 14,000 new cases. So depending upon the need, we design the campaign, and time to time we have these campaigns, and they have their own importance.
Sir, I would like to ask you that how important is the infrastructure for monitoring tuberculosis, and how the state government has been working on strengthening the ecosystem of the entire healthcare facilities about TB? Because as we all know, sir, it is a very, very deadly disease, and a lot of awareness is needed. More awareness is needed. So if you can, sir, please enlighten us about that a bit.
Yes. Certainly, no program can succeed unless and until it has the sufficient infrastructure. As far as the TB is concerned, a state is focusing primarily on development of labs. In recent few months, we have initiated 2 laboratories in the state. Culture and drug sensitivity testing laboratories have been added to the state. One was at Meerut, another was at Gorakhpur. In fact, the Gorakhpur lab is the most recent one that has been dedicated to the people of the state by Honorable Chief Minister on 1st of November 2020. Now we are going to add LPA components to these laboratories. We are simultaneously working on development of 4 other laboratories in the state, and they will be coming up at Jhansi, Kanpur, Etawah, and Prayagraj in next few months. But that will take some time. Establishing a laboratory, a culture and drug sensitivity laboratory, is a time-taking process with lot of investment. So we are already working on development of these laboratories, and in near future they will be coming on board. We are also developing a network of Zine expert laboratories. You must have heard regarding the CBNet machine. You must have heard regarding TrueNet machine. So we have right now we are having 145 CBNet machines across the state. And recently, during COVID times, we were working on the development of TrueNet laboratories in the state. And I'm happy to share with you that we have already established 449 TrueNet laboratories across the state. And these CBNet and TrueNet, these two laboratories, they will be very helpful in making diagnosis of the TB, as well as establishing the rifampicin sensitivity status of that patient. So they are very needed for identification of drug resistant TB, and which is also a very challenging aspect for TB elimination. And in addition to this, we are developing X-ray facilities in our district TB centers. So we are working on various projects to strengthen the infrastructure for providing better services to our patients.
Absolutely. So, if you can tell us about any more successful ventures which you have done for tuberculosis treatment in the state, so that other states can also follow these kind of examples. So, if you can enlighten us more about such examples of the success stories which have been done by the government.
Look, state is continuously making efforts to train the relevant people regarding the recent guidelines. The program is being run by the guidelines being provided by Government of India. So whenever there is some change in the guidelines, we immediately organize cascade trainings in the state for quick dissemination of these guidelines, so that our staff, our all the stakeholders, they are aware about the policy changes with regard to these guidelines. And to give you an example, that in last few months, we have launched newer drugs in the state. We had right now the bedaquiline. You must have heard about it. It's a drug which is for extreme drug resistance and multi-drug resistant TB patients. So right now this bedaquiline based regimen is available across all the 22 nodal DRTB centers of the state. Just 3 months ago, we have launched a delaminate based regimen in the state, and right now this regimen is also available on all the 22 nodal DRTB centers of the state. So we are keeping pace with the changes occurring in the guidelines, and we are trying to implement those changes in the state as early as possible.
Absolutely, sir. I agree. So, if you can tell us about the challenges which were faced during the pandemic last year, and how you coped up with the treatment of tuberculosis along with COVID-19. If you can tell us about that, sir.
Yes, COVID-19 has certainly posed a big challenge to the entire humanity. TB program was not an exception. It was also hit by the pandemic because our TrueNet machines, our staff, they were repurposed for COVID-related work. The majority of the staff, including me, were deployed for COVID-related work. In fact, I was coordinating the laboratory component, the development of RT-PCR laboratories and other laboratories in the state, and the linkages of district with the TV with various laboratories, that was being done, being coordinated by me. So there were a lot of changes, but despite those changes, I'm very happy to share that my state has performed reasonably well. We could sustain the treatment of all the cases which were notified to the program. And there was one more big challenge that all the patients who were residing in the state, they might have been registered in some other place, in some other district, or in some other state. But if they were staying in our area during that pandemic, then we supported all these patients with the drugs. We sustained the supply of drugs to all our patients, and I am happy that with the support from my team of NTP workers, we could ensure this uninterrupted.
Sir, in conclusion, if you would like to add something about the future prospects, and if you can give your views regarding the TB awareness initiative, which is going till 2025 as per the government of India. It is very important now that national strategic plan has been there, and the way it is working. So if you can tell us about your concluding words, and if you can advise and tell the mass that how it is being done and what could be done for the betterment of our country.
Like, no public health program can succeed unless and until there is a community involvement in a big way. In UP, we are working on various components of National Strategic Plan, including community participation. We are trying to identify TB champions and taking their support with some of the social aspects of the disease, like stigma reduction and advocacy for continued treatment. We are taking ensuring their involvement in these aspects. And I'm sure that with concerted efforts, with addressing various challenges of the program, we will be able to finish the job as per timeline prescribed by our Honorable Prime Minister and reconfirmed by our Honorable Chief Minister UP Shri Yogi Adityanath. The state is committed to finish the job within the timeline.
Absolutely, sir. And with everybody's and all the states coming together for eradicating this deadly disease, I'm sure we will definitely come up with a very, very much better results than last few years. Sir, I would like to thank you for taking out time and giving us this valuable time of yours for this interview. I would like to thank Panacea for setting the stage for the campaign about TB awareness initiative, and which is supported by Viatris. Thank you so much, sir, for joining us, and we will definitely be in touch with you and get back to you for further work and further procedures of how the government is doing. We would love to highlight that, sir.
Thank you, madam. Thank you very much.
Thank you so much.